So once you get diagnosed with chronic myeloid leukemia, or we often describe it just as CML, you're probably thinking, how long am I going to live with this condition? What are the potential risks of this condition? And we can define what we call prognosis with answering all of these questions based on a huge number of different variables. The first thing to mention before we discuss all these different characteristics of the condition and the patient is that chronic myeloid leukemia, or CML, is a very treatable disease. And because of the huge number of treatment advances, patients have very, very favorable prognosis. Obviously, there may be risks in terms of side effects and other issues, but overall, patients do very well with CML. If you were looking and you were diagnosed and treated before the 2000s, the survival wasn't very good. It was approximately 5 to 6 years, and many patients would end up requiring a bone marrow stem cell transplant to control their condition. Thankfully, with the introduction of targeted treatments, what we call TKIs or tyrosine kinase inhibitors, the prognosis is very, very good overall. And we're very fortunate now that patients, a lot of patients, can expect near normal life expectancy with very, very good disease control. And in a certain number of patients, we can even think about stopping their treatment. Looking back at the factors that define the prognosis in CML, there are a number of different things. What I usually say to patients at the beginning of their CML journey is that if they can tick the box of 3 factors, they'll do very well. So generally speaking, if you take the medications, we know that adherence to medication, especially early on in the condition's history, is very important. And that makes sense, really. If you take the medication, we can treat you and the disease recedes and goes into remission. The second thing is tolerating the treatment and making sure that the side effects are not worse than the actual disease. And we can do that using various different ways in terms of reducing the dose or switching your treatment to more tolerable side effect profiles. And we have videos discussing side effects as well. And the third thing is you're responding to the condition. So making sure that you hit the milestones with the genetic level, what we call the BCR-ABL percentage, based on defined targets of what we're trying to do at certain time points. So usually at 3 months, 6 months, and 12 months, and then onwards as well. There are other prognostic factors which are important and should be discussed with you. And this primarily involves the phase of disease. So we know that most patients with CML get diagnosed in what we call the chronic phase. There are other 2 phases called accelerated and blast phase. And as you go down to the more accelerated or blast phase, the prognosis tends to get worse. We define this stage of disease primarily on the number of early leukemic cells which are present in the blood and bone marrow. The higher the percentage, the higher the risk and the moving over from chronic to accelerated to blast phase disease. Like I said, most patients get diagnosed in the chronic phase of the condition. The other things which are important in terms of prognosis are certain chromosomal or genetic abnormalities that we can find at diagnosis. And it's important that we usually do this using a bone marrow test. There are certain genetic or chromosomal changes that we can find which may confer a poorer prognosis or a better prognosis depending on what those specific types are. And then we have prognostic scoring systems such as old scoring systems such as SoCal, you may have heard of this or this being discussed, or more modern prognostic scores such as the ELTS or UTOS scores. What these scores look at is specific factors within yourself, so looking at patient's age, the size of your spleen, the percentage of early leukemic cells which may be in the blood or bone marrow, as well as other specific types of important blood cells like the percentage of cells called eosinophils or basophils. And through some complex mathematics and calculations, we can work out different risk scores. Obviously, the higher the risk, the poorer the prognosis. Overall, it's important to note that, like I said earlier, the prognosis is very good, and there are a large number of treatments available for patients with CML, and it's balancing the toxicity as well. Overall, I just want to conclude that most patients are diagnosed in the chronic phase of the disease and do very well with modern treatments and do not require more intensive chemotherapy, but that may be dependent on the stage of disease, and it's important to discuss this with your haematologists and other healthcare providers because there are more nuanced factors that need to be taken into account when it comes to prognosis.